Hello, this is Jenny Lee. I am going to present a marketing analysis of one of Johnson & Johnson's medications, Invokana. I'll first start with a bit of background on J&J and Invokana, then move into describing the marketing mix, customer population, and competitors of Invokana. We will then move on to analyzing various factors that influence Invokana's marketing and finish with a description of Invokana's current marketing strategy and how J&J might further develop it in the future. Johnson & Johnson was founded in New Jersey in 1886. It works in the pharmaceutical, medical devices, and consumer products markets. In 1961, Johnson & Johnson bought the Belgian company Janssen, which became its main pharmaceutical company. Invokana was approved in the US by the FDA in 2013, and it was the first in a new class of type 2 diabetes medications called SGLT2 inhibitors. While Invokana showed efficacy for helping patients control their type 2 diabetes through several randomized clinical trials, it also showed an increased risk of lower limb amputations, and we will discuss that a little bit later in the presentation. Invokana has been approved in several countries across the world, but for this presentation, we're just going to focus on the US market. Invokana is available through prescription only, meaning that patients can't just walk into any pharmacy and get it, no questions asked. Patients first have to get a prescription from a healthcare provider, such as a physician or a nurse practitioner, and then they can get Invokana at a community pharmacy, such as CVS or Rite Aid, through an inpatient hospital setting, at a nursing home, through a mail order pharmacy, or any other similar area or place. Invokana is not a controlled substance, such as opioids or narcotics, which increases patient access to this drug, since there are fewer limitations on how many refills a patient can get for a script and how early a patient can get a refill filled. Okay, so moving on to the marketing mix. For product, we've already discussed how Invokana is an SGLT2 inhibitor developed by Johnson & Johnson, and it is used in patients with type 2 diabetes. For price, Invokana is only available as the brand name since J&J holds the patent for it for a total of 7 years. The wholesale price for a 30-day prescription of Invokana is about $480. But here in the US, many patients have either private or government insurance, such as Medicare, which covers some, if not all, of the cost. However, patients who don't have insurance or who are underinsured, they have to pay the full price out of pocket, unless they qualify for a coupon or a medication cost assistance plan through J&J. In the US, drug advertising is heavily regulated by the FDA since it's not a regular consumer product. Marketing materials for Invokana so far include an accurate representation of patients with type 2 diabetes, so they're generally older, and they focus on how Invokana can improve outcomes in patients that are important to them, such as spending more time with loved ones, so their grandchildren. J&J also markets itself as a company who truly cares about its patients. It emphasizes its credo, which is kind of its mission statement and a list of its core values, which places healthcare providers and patients at the top of its list of what's most important. And we've already kind of talked about place for Invokana. So Invokana is available in most pharmacies in the US with a prescription, but it is also available around the world. Since Invokana is a medication for patients with type 2 diabetes, those are the main customers for Invokana. In the US, there are about 30 million people living with type 2 diabetes, and of those, about 12 million are over the age of 65. Invokana is either paid for by insurance or directly by patients. Both are considered survivors according to the VALS model, so both are concerned about the high price of Invokana. For insurances, they typically will have patients try another cheaper medication, such as metformin, that has been around longer and are considered first-line options. So if they fail those, then they will eventually move on to consider something like Invokana. Patients are pretty much the same, except they don't consider the evidence behind medications as much as insurances do. So they don't consider what is considered first line or what has the better efficacy behind it through trials. However, both insurances and patients are heavily invested in patient outcomes. So if Invokana shows that it will improve those patient outcomes the most, such as better controlling of patients' diabetes or reducing cardiovascular risk, then insurance and patient payers will be more likely to pay for Invokana despite the higher price tag on it. So we're now going to look at the BCG model and where Invokana and some of its competitors fall in that. For Invokana, J&J is a very large company and has a pretty large market share. Despite being first approved in 2013, J&J is still exploring growth opportunities through outcomes trials for Invokana, which could lead to additional labeling for Invokana maybe. This puts Invokana as a star in the BCG model. Now, although there are a lot of type 2 diabetes drugs that are available for patients in the US, such as metformin, insulin, sulfonylureas, we're just going to focus on SGLT2 inhibitors for the purposes of this presentation. So the main competitor for Invokana is Jardiance, which was approved in 2014. Jardiance was developed by Eli Lilly and has a large market share for this class of drugs. It was given a label that includes decreased risk of cardiovascular death, which is something that Invokana doesn't currently have. This labeling is expected to help Jardiance grow more, so that combined with its pretty large market share makes it a star on the BCG model. The other SGLT2 inhibitor is Farxiga, which is a joint venture between Bristol Myers Squibb and AstraZeneca, approved in 2014. Market share for this drug isn't very large, and its sales continue to be steady, but there's little growth for Farxiga. So this puts it in the cash cow category. Moving along, we're going to explore some of the external marketing factors through a pest analysis. In the US, medications have to be approved by the FDA in order to be sold here. This includes what medications are indicated for, so what patients can use this and for what reasons, and what risks are associated with those medications. This can include a black box warning, which Invokana got in 2017 for increased risk of lower limb amputation. The black box warning is a very severe warning included on the label. So this black box warning decreases sales since it makes healthcare professionals less likely to prescribe it due to this pretty severe increased risk. For economic factors, Invokana is brand name only, so J&J is the only one currently making profits off of those sales right now. However, when the patent expires, generics of Invokana can enter the market, which will greatly decrease sales and profits. Many patients in the US are against big pharma, so patients are less likely to trust J&J as a company since they think they don't really care about patients and they just want profits. Technology is constantly evolving in the healthcare industry, so although Invokana was the first in a brand new class of type 2 diabetes drugs in just 2013, it's fairly likely that an even newer class of diabetes drugs will come out over the next few years, so Invokana won't be the newest and greatest thing for very long. Buyer power is fairly low since they can't control the prices. Although patients can and should work with their doctor to design their medication therapy plan, they often don't, at least not as much as they should. So patients will generally just take whatever their doctors prescribe them without volunteering any other options. Since Invokana is under patent, J&J is the sole controller of supply and price. However, they are limited based on rules and regulations by the FDA, and they don't want to set the prices too high since that could generate backlash from consumers. There's a fairly large threat of substitutes for Invokana, which includes other SGLT2 inhibitors, which we already talked about a little bit, as well as other type 2 diabetes medications, and there are a whole lot of them. There's hundreds of them. In the pharmaceutical industry, there's always a threat of new products entering the market since there is such a high demand for medications and new medications. It's more unlikely now that there will be new SGLT2 inhibitors since there are already a couple that are pretty well established, but other type 2 diabetes drugs may be introduced in other classes like insulins or even in new classes. Competition in pharmaceutical industry is fairly high, especially among larger companies like J&J or Merck or Novartis or some of the other large ones. However, those competitors may also be partners. So for example, Johnson & Johnson makes Levaquin, which is an antibiotic, and Bayer makes Cipro, which is another antibiotic, and they're competitors. However, J&J and Bayer are partners for the cardiovascular drug Xarelto, which is approved for preventing clots and AFib. So while they're competitors in one way, they're also partners. So it's kind of tricky for how pharmaceutical companies can work. So now we're going to talk a little bit about a SWOT analysis for Invokana. So Invokana, some of the strengths are for J&J, they're a very large company. They have over 130,000 employees across the world. So they have lots of money and lots of capital and lots of resources to expand their program. They've also shown efficacy with Invokana to the FDA and other health authorities across the world that shows that it does improve control of type 2 diabetes in patients. So one of the largest weaknesses for Invokana is that amputation risk that we talked about a little bit earlier. So that greatly decreases the likelihood of prescribers to give Invokana to their patients because of that large risk. However, there are quite a few opportunities for Invokana still. So J&J is still going through some outcomes trials in hopes of adding some labeling to Invokana, such as improved cardiovascular outcomes and renal outcomes. So the threats we've talked about in depth already. So Jardiance is probably the most direct threat and their largest threat directly. And as always, there's the threat of new classes of type 2 diabetes drugs that could be introduced within a couple of years. J&J markets itself as a company that really cares about its patients and healthcare providers. They refer back to their credo or their core values a lot when dealing with the public. So this really works well for gaining public support. Currently, Invokana ads focus on showing patients improve their lives. So grandparents getting to pay with their grandkids and people being more active. They also offer coupons and payment assistant programs for patients who can't afford Invokana themselves. So if they qualify, they could get Invokana for free or at a greatly reduced cost. For future marketing strategies, Invokana is really reliant on getting more things added to their label. So they're still looking at getting improved cardiovascular outcomes added. And in July 2018, they closed their renal outcomes study Credence early due to potentially overwhelming efficacy. So this really provides some great opportunities for the future for further marketing and improved sales of Invokana. So thank you for listening to this presentation about the marketing analysis and strategy of Invokana. This has been for Wilkes University MBA program for their marketing class. So thank you.